Hello and welcome to this edition of Lifelines on Mano Reporters. I am Kemo Chan. In this program, we will give you news, reports and analysis of science and health stories of the week. In this edition, we start with Mpox, the most pressing public health emergency on the continent right now. An Africa CDC team is expected in the country to boost its response efforts as the virus continues to spread unabated. The expert committee meeting to decide on the fate of the continental emergency status has been delayed as Africa CDC focuses its energy on Sierra Leone and other hotspots of the epidemic. We take a look at how lack of resources hampers response to the Mpox situation in Koinadu, one of the last districts to succumb to the virus. And away from Mpox now, we will also take a look at how a GAVI-funded project through Focus 1000 has helped boost vaccine coverage across Sierra Leone. These and more on this edition of the program. The Africa Centers for Disease Control and Prevention, or Africa CDC, is set to deploy experts in Sierra Leone to help the government contain the spread of the Mpox virus. Africa CDC Director General Dr. Jean Cassier said that stopping the spread of Mpox in Sierra Leone is a top priority for him to prevent an escalation of the epidemic in the wider sub-region.
Today becomes one of our major priorities. And I want to stop this outbreak in Sierra Leone to prevent a huge spread in other Western African countries.
Data from the National Public Health Agency as of May 18th reveals that the Mpox virus continues on its exponential increase. According to Dr. Cassier, the Africa CDC team will comprise 25 people.
We are bringing the full package: epidemiologists to understand the situation in the field. We are bringing lab experts to reinforce the capacity of the country. We are bringing colleagues for community support to train more community health focus. We are bringing colleagues for infection prevention and control, for case management. It means we are sending around 25 people in Sierra Leone, in addition to vaccines, in addition to all other areas of support.
Africa CDC also hinted at the possibility of increasing vaccine allocation to Sierra Leone, although officials warned that vaccines shouldn't be seen as the silver bullet for Mpox. Sierra Leone was initially allocated 63,000 doses of the Mpox vaccine, 61,300 of which was deployed in the country in March. As of last week, according to Africa CDC, 30,000 doses have been used.
We had a mission a week ago from IMST to Sierra Leone to discuss with the team and properly assess, one, is the plan being implemented properly in terms of vaccination? We realized that out of the 61,000 doses that has been allocated to the country and delivered, they've already used 30,000 of them, half of them. In the initial period, they were mainly focusing on the community, on the healthcare workers, while the main target was the sex workers and others. So they adjust the strategy so that they can really focus on the key population. That is a very good point. Now we are getting the feedback from them and working together on finding how much dose they will actually need to move forward using that very targeted approach. Based on that, we'll go back to the TLC so that a number of those are allocated to them. But as mentioned initially, the amount of those available at the global level, around 400,000, it's not enough. It's not sufficient. So we'll need to mobilize much more dose to work toward the local manufacturing of vaccine, because we won't be able forever to rely on our donors, our partners, to support our community.
Meanwhile, A planned meeting of the Emergency Consultative Group of the Africa CDC has been rescheduled. The ECG is a committee of experts that advises the Director General on scientific matters, and it was supposed to review data on the current status of the epidemic to advise on whether to maintain the emergency or to terminate it. The meeting was initially scheduled for May 18th, but it will now be held on May 30th. Dr. Jean Kassir, Africa CDC Director General, said that this is to allow for further assessment of the situation in Sierra Leone and other hotspots to provide more evidence to the experts for appropriate decisions.
We are thinking that cases were declining. Then we saw a huge increase, even new hotspots. The ECG will meet on the 20th. The ECG will help us, based on all the information that we have, to understand what is going on. We had our review, and we want to sit with our experts to understand how can we prevent this mpox to continue to be not only a public health emergency of continental security, but also a public health emergency of international concern. As you know, WHO is calling for a meeting in June for the HR committee to discuss if it's still public health emergency of international concern. I think this is where we are.
A recent assessment of Sierra Leone's mpox response by the Africa CDC exposed the weakness and incapacity of the healthcare system to handle the crisis. One problem the assessment team identified was lack of funding. This is illustrated in the response to the epidemic in Koinadu, one of the last districts in the country to yield to the virus. Its first confirmed case on May 1st, 4 months after the Ministry of Health declared a national public health emergency following confirmation of the first case in the country. If the state of emergency was meant to focus resources and efforts to prevent escalation of the virus, it hasn't reflected on Koinadu, where the district health management team is fearing for an escalation without urgent intervention from the government. In less than 2 weeks of recording its first case, Koinadu has seen cases rose from 5 to 18 as of May 12th, with 102 line-listed contacts. But there was no line listing of contact for 7 of the confirmed cases, which were reported outside Kabbalah, due to lack of resources to enable health workers reach the affected communities. Koinadu is crucial in Sierra Leone's mpox response due to its strategic geographic location and cultural practices. Kabbalah, the main town, is a major intersection for travelers connecting to Guinea and other parts of the country. And according to the district health authorities, many of the cases have been found to have travel history to mpox hotspots like Freetown and Makini, as well as Guinea. Some were even found to have gone to Kabbalah in search of traditional remedy for unexplained medical condition. Consequently, the health system of the district has proven incapable of responding to the disease. Some of the cases were still at home, despite the fact that the National Public Health Agency had announced an end to home-based treatment. The district medical officer, Dr. Stephen Foni's plan to train health workers outside Kabbalah on dealing with the virus has been held back by lack of resources.
They do WhatsApp communication because we're not able to reach them now for train them. We orientate them on this condition.
Train who then, sir?
The healthcare workers,
okay.
Within we facilitate them because not to just Kabbalah, we all concerned now that the one way they far back like Teliam and there. How they able for get that information there. So therefore we try for orientate them through a WhatsApp message. Although challenges, some people in that area it's difficult for them able to get network. Or if network there sometimes, then get for move like 2 to 3 miles before ever they able to get network. But they
The Global Vaccine Alliance, otherwise known as GAVI, has been at the forefront of efforts to protect Sierra Leone's population from vaccine-preventable diseases through its financial support via partners like UNICEF and local organizations. One such local organization is Focus 1000, which has worked with the Ministry of Health to reach some of the most hard-to-reach communities in the country with vaccines. Yumotown in Bo is one community that has benefited from this support, as indicated in this report.
Na bills day na the Yumotown Community Center. Outside the new Combra dem bring them pikin them for cancer vaccine as part of the routine where the facility can provide. Six-month-old baby Joy just don't get enforced malaria vaccine. And mama being glady because they don't protect him pikin from one party bad sick them where they kill pikin them na salon.
I'm glad they don't give me pikin malaria medicine, the vaccine. So I'm happy because of pikin not go sick again. Yeah, I'm glad for that day.
Yumotown na one party community dem na Bo where benefits from the GAVI support program where they take life-saving vaccines so side them where ask for reach na salon. GAVI then support they come through Focus 1000 when at the local NGO where they help in sensitization and social mobilization.
1000 it don't really motivate you and it don't help you a lot compared to the first time because like even first time we can go do outreach because I think where you've done the part of this hospital. Then before say Focus 1000 in the camp. We've done do outreach. But the way they don't come in now for come out this week, where the impact is too great.
One for got 10 where we get Focus 1000 because before now we be the guest challenges them. But since then, where they don't intervene now for can support the process, the intervention don't make now the challenge don't become somehow minimized.
You can watch the full report on our website at manonreporters.com and our social media platforms on Facebook, Instagram, and YouTube. Imagine you feel very sick and go to the hospital, but the only medicine that is used to treat your sickness, you are resistant to it. This is the phenomenon known as antimicrobial resistance, or AMR. It is the situation where microorganisms like bacteria, fungi, and viruses, which usually cause illnesses in humans and animals, develop resistance to the drugs they are meant to treat. Many people are dying as a result of AMR. Until 2004, for instance, chloroquine was the first-line treatment for uncomplicated malaria in Sierra Leone. That changed as a result of evidence of resistance by the parasites to the drug. But there have been efforts towards addressing this phenomenon. Last week, some of the stakeholders involved gathered at the Freetown City Council to deliberate on a less discussed related topic: the intersection between AMR and adolescent sexual and reproductive health care.
The meeting brought together partner organizations in the European Union supported by Youth for Health projects, Maristo, Health Alerts, and the Ministry of Health. And the aim, according to organizers, was to strengthen outreach that targets adolescents directly through schools, community spaces, social media, or hospital facilities with appropriate information to discourage drug misuse or overuse.
With limited access to sexual and reproductive healthcare services, most of our adolescents are often pushed to use antibiotics inappropriately. So there is increased self-medication practices, as we are all aware, particularly with the existence of a lot of informal drug selling outlets. Some of the antibiotics that these adolescents use may even have suspect quality. They are unverifiable. So the intersection between antimicrobial resistance and adolescent health is real. It is urgent, and it demands targeted attention.
My uncle used to say that one key thing or one key symptom for active men was the number of episodes of gonorrhea that you had. Because in those days, they know that gonorrhea is easily treatable with a basic antibiotic. That is no longer the case, we all know. And so because of this threat, AMR should be taken seriously. And we also are aware that when AMR or other threats in the health system happens, it disproportionately affects women and adolescents. And as an organ of the ministry that is responsible for SRHR, we've seen post-harm where basic infections like those that I mentioned are no longer easily treatable. We are spending a lot of money on them. Patients are losing their life and their dignity in this cause. So our comprehensive approach will always be together here, as we do, have a robust sexual education, and thus the presence of CSO is very important in gathering and deliberations like this.
If issues around antimicrobial resistance, the misuse of antibiotics, etc., is an issue, and therefore it's a concern for us as civil society. Over the years, for the past 2 years or more now, we have been working on a project known as the Youth for Health Project through the support of Maristos International, but of course with Maristos Sierra Leone here. And this project is targeted to 3 districts, Cambia, Port Loko, and Western Rural. And of course, several engagements we have had with those stakeholders around that district regarding the project. And of course, these are critical issues that we have realized that came up also into discussions with the young people. So what do we do as civil society is to kind of listen to what the presentations, as technical people, what are your recommendations? How do we forge this partnership to make sure we raise our voices, to make sure the young people that we are working with come to the realization that they need to be very much conscious about these drugs and the side effects that they create for their lives and their systems. Largely, of course, you see we have over 60% of young people who are girls, and we all know the story around the use of these drugs. So this project has targets to make sure these young people fully understand the side effect, the implications of overusing these drugs that cannot help their.
Addressing AMR is further complicated by poor regulation of the pharmaceutical sector in Sierra Leone, which has seen a proliferation of informal and unauthorized drug sellers all over the place. Some of these drug sellers, including the regulated ones, deliberately put profits before professionalism, thereby selling prescription drugs without prescription.
Self-medication is another route for misuse of antibiotics. Okay, based on the fact that this person, when this person have this particular infection, he or she takes this particular antibiotic. So you usually go to the pharmacy and then you purchase the same antibiotic. So you think that it will just work for you, just the way it works for the other person. And then, of course, we see inadequate youth-friendly health services. That is to say, we go to a particular clinic or site where we are expected to get unique information about certain antibiotics, but then the person will be schooled.
You don't know how much damage you cause by either doing what the client wants because they're paying, or willfully offering a service that would not be of benefit to the client and would actually add or cause more harm. I graduated in 2007 when levofloxacin was retailed by probably 2 pharmacies, and you had to have a prescription. Now it's like paracetamol. You see it everywhere. And with antimicrobial resistance, you have not just the women, the adolescent guys or young girls. You have potential of this also impacting newborns as well. So when STIs cannot be treated, we know you have concerns about fertility, you have damages to other organs, and then you also have potential infections in the newborns, and then we can also have issues with increased maternal mortality, more cost for treatment, and then even newborn mortality.
The World Health Organization considers AMR as a global public health and development threat. The UN Health Agency estimates that bacterial AMR, for instance, was directly responsible for the 1.27 million global deaths in 2019, the latest available data.
That's all we have for this week. Thank you for watching and see you for more next week.